Pilocarpine. A 62-year-old woman suddenly develops excruciating eye pain, headache, blurred vision, and sees halos around lights. Her ophthalmologist diagnoses acute angle closure glaucoma and immediately instills pilocarpine eye drops. Within minutes, the pressure inside her eye begins to fall. How does one drug rapidly reduce intraocular pressure? Let's understand the pharmacology of pilocarpine. What is pilocarpine? Pilocarpine is a natural alkaloid derived from Pilocarpus plants. It is a prototypical direct-acting cholinergic agonist. It stimulates muscarinic receptors directly, mimicking the parasympathetic nervous system. Mechanism of action: the eye. Let's now understand how pilocarpine lowers intraocular pressure by acting on two important structures in the eye. First, consider the iris sphincter muscle, which contains M3 receptors. Pilocarpine stimulates these receptors to produce miosis or pupil constriction. This constriction pulls the iris away from the trabecular meshwork, reducing obstruction to aqueous humour drainage. Next is the ciliary muscle, which also contains M3 receptors. Stimulation of these receptors causes the ciliary muscle to contract. This contraction mechanically opens the trabecular meshwork, allowing a greater outflow of aqueous humour. The net effect of these two actions is that intraocular pressure drops rapidly, which is the key therapeutic action in glaucoma. Mechanism: exocrine glands. Beyond its effects on the eye, pilocarpine is a potent secretory stimulant. It acts on muscarinic receptors present on the secretory cells of exocrine glands, producing widespread parasympathetic effects. The first major effect is increased salivation, leading to a marked increase in saliva production. This property makes pilocarpine particularly useful in treating xerostomia or dry mouth, especially in patients with Sjogren's syndrome or after head and neck radiotherapy. The second effect is increased lacrimation, meaning enhanced tear production. Finally, pilocarpine also causes diaphoresis or profuse sweating by stimulating sweat glands. Adverse effects. Let's begin with the ocular adverse effects. Because pilocarpine causes miosis, patients may experience blurred vision, especially in dim light, as the constricted pupil allows less light to enter the eye. Contraction of the ciliary muscle may also produce a brow ache and ciliary spasm, making it difficult to focus on distant objects. Now let's look at the systemic adverse effects, which are seen mainly with oral use. The most common systemic effect is sweating or diaphoresis due to stimulation of sweat glands. Patients may also develop salivation, nausea, vomiting, and diarrhea because of increased gastrointestinal and glandular activity. In susceptible individuals, pilocarpine can cause bronchospasm, making it unsuitable for patients with asthma, and bradycardia due to increased vagal stimulation of the heart. So, whenever you see the adverse effects of pilocarpine, remember that they are simply the expected consequences of generalized parasympathetic stimulation. Clinical uses. The most important indication is glaucoma. Pilocarpine is considered first line in acute angle closure glaucoma because it rapidly lowers intraocular pressure by increasing the outflow of aqueous humour. It may also be used in chronic open-angle glaucoma, although this has become less common now because newer drugs such as prostaglandin analogues are more convenient and better tolerated. Another important use is in ophthalmologic procedures. After an eye examination, drugs are often used to produce mydriasis or pupil dilatation. Pilocarpine can reverse mydriasis, restoring the pupil to its normal size. Pilocarpine is also given orally to treat xerostomia or dry mouth, particularly in patients with Sjogren's syndrome and those who develop salivary gland damage following radiation therapy for head and neck cancer. Finally, pilocarpine has an important diagnostic application. By producing intense sweating, it is the standard agent used in the sweat test to diagnose cystic fibrosis. Key takeaways. First, remember that pilocarpine is a direct M3 agonist. It stimulates muscarinic receptors directly, producing the characteristic effects of parasympathetic activation. Second, it constricts pupil by stimulating the iris sphincter muscle. This is an important part of its action in glaucoma. Third, pilocarpine lowers intraocular pressure or IOP in glaucoma. By contracting the ciliary muscle, it opens the trabecular meshwork, increasing aqueous humour outflow and rapidly reducing intraocular pressure. Finally, remember its important non-ocular uses. Oral pilocarpine treats xerostomia or dry mouth, while its ability to produce intense sweating makes it useful in the diagnosis of cystic fibrosis through the sweat test. So the key message is that pilocarpine's targeted cholinergic action makes it indispensable across ophthalmology, rheumatology, and diagnostic medicine.